Hi, I'm Dr. Angela Lamb. I'm an associate professor of dermatology at the Icahn School of Medicine at Mount Sinai. We understand so much more about prurigo nodularis and just itch disorders at their core in general. We have so much immunology understanding of all the interleukins that play a role in what we like to call that itch-scratch cycle and that neuroimmune crosstalk that drives prurigo nodularis. When you have that itch, it's not like you can just stop scratching. It really goes to the core. So there are receptors on the dorsal root ganglion, also mast cells, basophils, keratinocytes, that actually will lock on to interleukin 31 and keep the whole chronic cycle of the itch and the scratch that then leads to those little bumps, those prurigo nodules that patients find so disruptive and also can really wreak havoc on their life. Not only is this physically disruptive, but imagine if you're scratching, you can't sleep, you can't function the next day, you're embarrassed, people are wondering if you have an infection. Nemolizumab or Nemluvio has been such a groundbreaking intervention and medication that I've been able to offer my patients because it gets at that itch at the core, at the root of where it starts. Again, dorsal root ganglion, mast cells, basophils, keratinocytes that actually, again, have those receptors for IL-31 and drive so much of that neuroimmune and the crosstalk between our body and what we see and also what we feel. What's amazing about Nemluvio is it also is actually a powder and a water reconstitute. So it's low volume and patients can, by the time that they are actually on their maintenance dose, inject themselves once a month in a virtually pain-free modality. I've found it to be a great option for my patients that want safety because there's no black box warning, there's no lab monitoring that they have to be mindful of. And again, it can give them that relief and it can allow them to sleep, really give them that almost, I'd say, break the chains of the itch scratch cycle that has often been so disruptive for so long. What we understand now about prurigo nodularis is that it's primary a T helper cell 2 driven immunopathway. So there are different sides of the immune system. So you have a T helper 1 or Th1 or Th2, and really prurigo nodularis drives more towards the Th2 inflammation pathway, which IL-31 is such a key aspect of. So if we can block those receptors, and again, right at the receptor, so what I like is when you understand the science about how interleukins work, it's really a receptor there that the interleukin comes, binds to, and then there's an upregulation of all of these interleukins and the DNA that goes back and binds and it keeps the cycle going. So if you go in there and block that, you're really getting at the core of what's driving so much of that inflammation. Also, because there are IL-31 receptors on the keratinocytes, those are actually at the surface of our skin. So that inflammation, the actual physical manifestations of PN, it's blocking those as well. So what we can't see, that dorsal root ganglion, but also what we can see. And so that's what makes it such a powerful medication for really getting at the core root causes of the pathophysiology of prurigo nodularis.